Hi, I'm Dr. Abraham Lieberman with Bellaire Physical Therapy. I'd like to talk with you a little bit about amputee rehab, my passion. So, I saw a patient 2 weeks ago, came to see me, drove all the way down from Humble, Texas. We're in Bellaire. And I said, all the way from Humble? You couldn't find another physical therapist? He said, no, man. I actually went to another physical therapist, and she walked into the room, she looked at my leg, and I could see she was not familiar with amputees. So I told myself that I want to get the best because I want to go back to hiking. I want to go back to, exercising full time. And I got this $80,000 leg and I'm using a crutch. Well, I worked with that patient and I've been working with him since just a couple of weeks. And he's already so happy. Just one session, he went from using 2 crutches to using no crutches. Right? He had a lot of pain in his leg. We were able to reduce that by identifying a sural nerve peripheral neuropathy. Sural nerve peripheral neuropathy, what is that? Lower limb tension. I mean, most people don't even know what that is. Well, the sural nerve is a branch off of 2 different nerves that comes down behind your calf and by your knee, and it can cause all sorts of pain when there's some sort of tension or compression on that nerve because of anything. It could be the way you're sitting, it could be a position that you've been lying in, it could be from a trauma, it could be after the surgery, and he couldn't identify it. His doctor couldn't help him, his prosthetist couldn't help him, and the physical therapist had no idea what it was. But we identified that. We gave him some exercises, we did some treatment, pain is gone. Patient came in to see us, and I told him, you're an engineer. That means you're going to try to fix your leg yourself. Let me advise you, don't mess with your leg. As much as you want to, by every time you play with your leg a little bit, it's going to change the angle, it's going to put the force in a different place, and you're going to be down this rabbit hole, right? Let your prosthetist work with your leg. I remember one patient that came to see me, he was from Saudi Arabia. So he had his leg blown off, unfortunately, in an accident in the oil field. Worked for Aramco. And he had this beautiful leg called a genium knee. The genium knee is like an advanced C leg. If you know the C leg, that's made by Otto Bach. They have this amazing computerized knee that can do all sorts of stuff. So the genium knee was the next level, but nobody had ever used it. So you have this guy, he doesn't speak English, and he calls up his prosthetist and he says, I've got this great leg, but I can't use it. I don't know how to use it. And he says, who can help me? And the prosthetist says, there's only one guy in town that I know that can help you with that leg. Abraham Lieberman. So that comes to see me. He's got his driver. He's got his translator. He comes in and we do rehab for about 6 weeks. And this guy was walking up and down stairs with this leg. He couldn't believe it. He was jumping. He was running. He was squatting. Couldn't believe it. I mean, the people at the prosthetist couldn't believe it because although they knew that it was possible, they had never seen it before. We love working with amputees here. The hardest part for an amputee is probably to keep the appointment because often they need somebody to drive them. Sometimes they have other issues that make it difficult. They have pain, they can't get their leg on. We'll work with you. We want to work with you, we want to help you. So if you want the best there is in amputee rehab, come see us at Bellaire Physical Therapy.